Welcome back. I hope that the first series has helped you, and you're doing those, and you're hoping to. You've already started experiencing some relief in your neck, also in your shoulders. You know your back, your posterior shoulder. That is not your front, but like in the shoulder blade, close to the neck. All right. That area also that you're also feeling some relief in your hips, very light relief in your hips, as well as some strength returning in your midsection. All right. So from this series, we're going to be go ahead and address some seated stretches that you can easily do. So with that being said, here we go. Now some of these are going to look very similar to where we were in our first series. For starters, you can take a seat on a chair. All right, this is a good way to start. Hands flat, feet flat on the ground. All right, spine erect. And we're going to start with some of our seated exercises is yes and no's and long distance phone calls. So to begin, yes. Once again, head at neutral, chin to the chest, no strain, up and down. What's next will be nose. Chin to the shoulder. No shoulder coming forward, no shoulder reaching back. Shoulder nice and settled. Chin going as close to the shoulder as it can. Switching sides. Be sure to breathe. Whatever rhythm it is that you find yourself comfortable with breathing, just breathe. We'll address getting better breath control another time. If you found it difficult to perform some of these stretches while you're laying down, shortness of breath, anything of that nature, this is a great way to help relieve that by sitting up. You take the pressure off the abdomen, which would normally be pushing into the lungs when you're laying flat on your back. Okay, so this should help relieve some of that discomfort with your breathing if you suffer from any kind of shortness of breath due to large midsection. Next is from our yes for the things that we want, and our no's for the things that we don't want. Comes the long distance phone call. You gotta phone a friend. Bring the shoulder to the ear. Excuse me, the ear to the shoulder. Bring 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 the ear to the shoulder. Why am I making noise? Because it feels good. And if it takes making loud noises to ensure that you're breathing, do it. So how you feeling so far? You should feel pretty good. Tell you what, I know I do. It's pretty late in the evening. I'm already feeling good. All right. Now, the next thing that we're gonna do is some of the shoulder exercise. But before we do that, what we're gonna do is we're gonna make that long distance phone call. This is the real long distance phone call. Okay. What we're gonna do is we're gonna bring our shoulders to our ears as high as we can. Relaxed hands. Our elbows do not move. Just our shoulders. Shoulders come up, shoulders come down. You don't have to bring your shoulders down as hard as I did. And you can stretch your shoulders down. Let me go ahead and give you a little bit more light on the situation. Here we are once again. Now some of us may be feeling a little bit of strain here, right along our clavicle bones, okay? Now that is perfectly normal. A lot of us have a lot of tension here. We hold a lot of our stress, we slouch. The muscles here, if you haven't noticed or you haven't come to understand this already, the muscles in the chest are attached to the muscles in the shoulder. And so when you slouch, you train your body to take on a position that is unhealthy, all right? And by the body's adaptation of an unhealthy posture, you begin to have what is a mild form of atrophy or decay of muscles, which means that you'll have a shortened range of motion. You have to retrain the muscle to open back up. So with that in mind, I also would like for you to practice something called the clavicle massage. At this point, you should be feeling a little bit of stress underneath, just a little bit, in which case what you're going to do is just massage just underneath the clavicle bone. Just underneath the clavicle bone. Now you see that I'm also stretching my head. This helps relieve a little pressure on the muscle called the platysma, which inserts into the chest, comes from out of underneath the jaw. So if you, I don't want to gross you out. You see, you flex the platysma. You see that sheet of muscle over the muscles of the neck. Okay, and you see where it inserts. Here into the chest. Here into the back. So, by massaging these, you also see the same activation of those muscles that were once flexing when I was stressing my face like that. Stressing the platysma. Okay? You can move. And also, there's a very important artery that comes out from underneath, from out of the heart, and it travels along the clavicle. It's called the subclavian artery, alright? This artery will actually feed into your arm, down from into your chest. It'll go below this big pec muscle into your armpit and travel along the medial side or the inner side of your arm. Alright, so if you ever feel cold or tingling sensations in your hand, or even a lack of, or once again, just cold or a tingling sensation, or both, in your hand, or even just like the sleepy hand syndrome, or like you've been sitting on your hand for a long time and you pull it out and you're like, oh, the stranger. Sorry about the stranger. Whatever. Yeah. Massaging this area in the chest will also improve the circulation of blood flow into the arm, so you can relieve that achy, tingly, cold hand sensation. And once again, we have two sides. The universe saw fit the pluses with two, so we will work both sides. Underneath the clavicle. Underneath the clavicle. Underneath the clavicle. Underneath the clavicle. Now how am I doing this? I'm taking 3 fingers, I'm making a circular motion underneath the clavicle bone. You see I pull the muscle down, you see the clavicle bone pop out here. Push in underneath and pull down. You'll feel it. You'll know that you're doing it right. If it hurts, it's because you got poor circulation. If it feels good, you got some good circulation. And if it hurts, it just means it needs some attention, you know. The bodies, we neglect our bodies, these vessels, these divine vehicles that house our souls, you know. We neglect them. You know, massage therapy is not just about relaxation. It's prevention, or rehabilitation, or maintenance of an otherwise healthy or an unhealthy body returning to a healthy state. Massage therapy is not going to cure it all, but it will help in assisting your body get back to a place of health where it can help itself become healthier. So my neck is feeling pretty good and loose. My chest is too. Tell you what, my hands feel good and circulated. We're not even getting to the hand stuff yet. We're just focusing only on the core. So now we've opened up our chest. We should feel nice and relaxed here and limber. You can even do a little stretch on your chest by going or pressing into in between the spaces of the ribs. Okay? There is muscle in between that. Underneath that muscle is actually your lung. Okay? So you can massage these areas. You know, this is not a bad thing. We gotta also get out of the misconception of, or the false or the foul misconception of touching ourselves. All right, it's important to touch yourself. If you don't touch yourself, you really shouldn't be allowing anybody else to touch you, unless they're trained. Massage therapists, physical therapists, acupuncturists, doctors, occupational therapists, okay, orthopedists. People we should not be afraid of, okay? People that should be there and are there if you are willing to find them, who can help you learn this type of information, okay? Now I'm traveling along the ribs, along the pec muscles, all right? I'm just basically following the rib, okay, following the space of the ribs. I'm also breathing. Hey, you could even cross. However you want to do it. Crossing may activate the muscles of your chest. So when you get to this point of your pushing out, you may actually flex the muscle. It's just like, this shirt really isn't helping. So I'm going to help out. See. So, okay. So you see I got some redness here. You see some blood circulating here in these areas. That's a great thing. Alright? Once again, that's the circulation improving. Just following the ribs. Oh my goodness, he's tenderizing his chest. Yeah. Tenderizing means, you know, softening the muscle tissue. Nobody, if you're a meat eater, do you really like eating tough meat? I'm not even going to tell you what my theory is on eating meat. You know, to each your own. But, for those of us, for you, at home, it's important to understand that as you become a healthier being, you will find and identify that certain foods react better with your system and certain foods do not. Okay? Now, come to a realization of what serves you and what doesn't. Okay? I'm not going to tell you what you should eat. Alright? Even though I may want to. I'm not going to do that. Alright? But our food is an addiction. It's important for us to understand that we eat in just about all occasions. We eat in the morning, we eat for breakfast, for lunch, for dinner. In between those things, we eat in celebration, we eat in mourning, we eat. But the food that we eat also has a great effect on our body. You've heard the expression, you are what you eat. Well, if you eat something that's living, that's always been moving, that's low in calories or, you know, high in nutritional content, then you'll also exhibit the characteristics of the food that you eat, you know. So if your food is low in calories or low in fat, then you will also exhibit the kind of body that is low in calories or low in fat. And so, and ladies, this is also a good thing for you to do, you know, rub your chest, you know. Cancers, tumors, growths, all these things occur because there's no circulation, okay? So move it. You got something called the lymphatic system, alright? The lymphatic system is basically in between the skin and the muscle tissue, alright? And they clean and filter all the cells and tissue that our body is covered by, alright? If that's stalled, if that's not moving, then you could also be suffering from some emotional distress, such as depression. You know, for one, you can look it up. Look it up. I strongly suggest that you do. You know, because you don't want to be just looking at somebody's video on YouTube blindly, like they know everything. But how many of us actually do that at the doctor's office too? So take this pill and take it 6 times a day, and take these other 14 pills that go with it, and I'm gonna feel good. All right. Oh, and for this, for the side effects for this pill, I should be taking this other pill. All right. Okay. Some of us are, we have to get out of the misconception that our medicine can only come in the form of a pill. All right. Your medicine can come on a plate. If it makes you feel any better, they both start with P. There you go. Alright, we've been massaging our chest, alright? So that should make our chest feel nice and good. You don't really need to do too much shoulder stuff unless you have shoulder ache. If you have shoulder aches, I got another series of stuff for you, alright? Now, what's next is what we're going to be doing is some hip exercises, alright? Some hip stretches. So what we're going to be doing is, one, we're going to bring our leg up here. Actually, we're going to start with some simple stuff. One, just turning. Just turn your body. Now, if you can't get this far, it's okay. If you only come this far, that's fine. That's alright. If you only come this far, if all you can do is just put your hand on the other side, that's fine. Use it as a stepping stone. Alright? Be aggravated by it. Let yourself know, I don't want to stay stuck here. I want to get more flexible. I want to be limber. I want to be thin. I want to be healthy. I am healthy. I am thin. I am happy. Ooh, I feel good. Yes, you do. Switch sides. Remember, this is all you can do, that's fine. No problem. Alright, doesn't that feel good? What else you could do from this position is a little seated calf and cow. Arch your back. Fill the belly, fill the abdomen. Squeeze it out. You'll feel release in the lower part of the back. These are very simple stretches. Nothing that takes a lot of strain or puts a lot of strain onto your body. Then, hands to the knees. Straight back. Arch. Breathe in, expand the stomach. Breathe out, squeeze the stomach in. Inhale, fill the belly. Exhale, squeeze the belly to the spine. Come back to neutral. Straight back, straight back. How you feeling so far? Feeling pretty good? Good. Let's go ahead and do one more side twist. If you got a fart, excuse me, if you have flatulence at this point, you feel like you have to release a little bit of gas, if you are in the privacy of your own home, I suggest you do it. Okay? It is better out than it is in. Alright? Cramping, abdominal discomfort, that's all gas. Alright? That's all gas. Let it go. Alright? If you feel you got too much gas, then you need to be identifying what's going on in that belly of yours, okay? Gotta understand the science of what you eat. What you and me all eat. It means something. Stretch the other side. So there is our lower back stuff. And then the next thing that we're going to be doing is stretching a little bit of hip. Alright, the way that we do that, you're going to begin by one, cross your legs, bring the leg up, and then twisting the body. Once again, another twisting motion. From this motion, you can also keep the leg down, bring the foot up, but if you can't bring the leg up this far, it's okay. Bring it as far up the leg as you can. If you can only come here, that's okay. That is alright. If you can come up here, that's better. If you come up here, that's even great. If you can come up here, now we're getting somewhere, okay? Not everybody can do this. But I've seen 80-year-old people do this. So there is no way that you can tell me that this is impossible.